Hello everyone, this is Dr. Sneha Shetty, Clinical Director, Chief Fertility Specialist, Laparoscopic Surgeon at Vriksh Fertility at HSR and Whitefield, Bengaluru. Now, most commonly asked question is, Doctor, can I take the injections on my own or should I come and visit the hospital every day? Now, most of the IVF centers nowadays, they give subcutaneous injections, which are usually pen-like injections. Think of it like insulin kind of injections, which you can take it on your own. It's very easy to administer, absolutely painless. The only thing is that you have to take it in the right way. Your fertility clinic is going to teach you how to take it. Now, some of the tips which I would recommend is to clean the area with a sterile swab which is provided to you by your IVF center. Change your injection sites every day in order to avoid any kind of bruising. Third, use an ice pack if required to suit your pain, if any. Remember that some injections, especially the trigger shot, may require you to take it at the perfect time. So, set your alarms. Now, what are the potential side effects of these IVF injections? Mild side effects like bloating, headache, mood swings, and mild abdominal cramp may be present for some. Now, only serious side effect complication which we do not see in today's cases is called the OHSS or the Ovarian Hyper Stimulation Syndrome. This happens when the ovaries over-respond to the stimulation. Symptoms could include severe bloating, severe abdominal tenderness, rapid weight gain, breathing difficulties, etc. Most of the clinics right now are OHSS free clinics because of the perfect protocol which are followed by your fertility doctors. But sometimes, very rarely, some patient may experience mild OHSS symptoms too. So always report to your doctor and avoid self-medication in such cases. Worried about your IVF injection? Wondering how they work? And why is it important? Today, let's discuss about it. Now, IVF procedure involves hormonal injections which are given in order to produce multiple eggs in your ovaries. Usually, there are two types of injection. One is to grow the follicles which are present in your ovaries, and second is to prevent them from rupturing, that is, to prevent them from ovulation. Yes, they do involve needles, but they are very thin needles and trust me, absolutely painless if taken in the right way. Now remember that the right dosage is the key to getting very good quality eggs, which your doctor will take care of. Now what happens if you miss an IVF injection? Timing is everything in an IVF cycle. So missing an injection may actually cause harm and impact your IVF cycle. If you miss your dose, what should you do? Call your clinic immediately. They may advise you to take the dose if it is not too late, or they may take a decision whether you have to take another kind of an injection or something else has to be done depending on when you are calling them and how much time has passed since you have missed the injection. Number 2, never take double dose without informing your doctor. Number 3, for trigger shots, missing the injection can sometimes lead to cancellation of the cycles. So make sure the trigger shot is taken perfectly and at the right time. This is why alarms, reminders, and proper planning are very important in your IVF cycle. Now, IVF injections can feel very overwhelming, but understand that the right guidance, proper planning can make things very smoothly and you can carry on with your day-to-day activities while taking them as well.